It's an exciting time for UBH to have a success story like baby Rachel Mhlanga's story. This baby was born severely preterm, meaning he was born before the gestational age, which is expected 40 weeks. Her story is she was born at 28 weeks and she weighed 400 grams at birth, 405. As we speak now, when we are releasing her, she's 1,860 grams, and we are happy to send her because now she can be looked after by the mother alone. She doesn't need support from machinery like a continuous positive airway pressure, a CPAP, or she doesn't need phototherapy anymore. The mother has been taught how to kangaroo, like a kangaroo animal keeps its baby in a pouch. The mother kangaroos by use of linen. The baby will be strapped skin to skin on her chest, and she can do it while she's doing chores at home. This baby is the third in the family, according to the mother. Why she is agitating to go like this is because the other two siblings don't have anyone to look after. So we still happy, but we'll keep a close watch on the baby after discharge.
Is this the first of its kind success story to have the baby born weighing that much and surviving the stage?
I can only speak of 2025 because that's what I know, that this is a success. We have never had anyone less than 1,000 grams surviving.
And then what made the mother to give birth at 28 weeks? Was she having complications? What triggered?
Yes, she had some infections, the mother in the uterus. That's what triggered the premature birth of the baby. So, and the baby was not growing very well. I think that's why it was only 405 grams. At 28 weeks, we expect it to be 1,000 something grams.
So life after this, will the baby grow up as a normal baby, or there will be some challenges that may be experienced?
We have sent the child for a transfontanel ultrasound scan here today at Mpilo. That is, we are anticipating that the child might have hydrocephalus. We wanted to rule that out, and it has been ruled out by the scan. So the baby so far is growing well.
Ashomhlanga ngizojabula kakhulu ngalokho okwenzakeleyo, ngibona inkosi uNkulunkulu ethe yasenzela khona ngoba sisodwa kasikwanisi, but konke we put God first. So ngiyathaba kakhulu ngalokho okwenzakeleyo lalokho engikwenzele isibhedlela se-UBH.
Okay, ngasichasisela ukuthi when the baby was born, what happened on that day? Izelibwe lapha esibhedlela.
Okay, ngabuya lapha esibhedlela ngiya for i-check-up. For i-check-up yami it was 28 weeks. So ngifika ku-28 weeks and then they said i-BP yami is too high. Bazama ukuthi bangi-admit ukuthi iyehle. But and then they discovered ukuthi akusayenza ukuthi umntwana bamhlalise phakathi esiswini. And then they said I should do a scan. Scan is Dopplers. So his scan I had to do Dr. Splanda a town. And then Dr. Scan is siphuma sithi placenta yadavuka amanzi akusele esiswini umntwana mncane kakhulu. So sasesiphenduka ngapha ukuthi sifuna ngapha e-UBH, and then we had to come back ngapha e-UBH. And then e-UBH basike sithi ya umntwana akasakhuli and there is no way lapha ngakhula khona, so we had to remove umntwana to save life mama as well as yomntwana. So they just said they will try their best, but what will happen. So I had to go for an operation. I was op. And then op, in fact, it scans at umntwana it's 600 grams, but and then op operate was 405. So from there umntwana basebemthatha bembisa escoop. But then I thought ukuthi umntwana vele kasekho just because wayemncane kakhulu. But to my surprise ngathi ngibuya ngafica umntwana ekhona eScoop, and then they just said ukuthi they will try ukuthi banjani bamonithe bayenza abakukwanisayo, but okunye konke kuzabonakala ngokuhamba kwesikhathi. But to my surprise umntwana ngambona lokhu ephika up to yesterday nje ukuthi wasekhishwa le oxygen eseziphefumulela yedwa. And then sachova kuhamba kunjalo, and it was very difficult, kwakungekho lula, kwakunzima. But sibonga umthandazo from my overseer we-AFM owasifakela umthandazo. And then again ama-sisters, they were working very hard, ama-doctors working very hard, not ukuthi ukwelapha ukuthi maybe ukwelapha umntwana kuphela, but also ukungiphusha mina, like supporting, kungisupport, bangi-uplifta kakhulu. So ijeni yangibona it wasn't easy, but with the staff salapha e-UBH kwaba lula kakhulu.
So to us at UBH, I think it's a milestone, not only for UBH, but the whole nation of Zimbabwe, having a 405 grammar, making it. As you know that preterms have got complications that come with as they are born before time, like breathing problems, because the lungs are not mature enough. They have issues with low blood, infections, the immune system is not that strong. They may develop feeding problems along the way, but I would want to congratulate the team in nursery for such a sterling job, staying with the patient for almost 115 days, and was on oxygen for about almost 3 months on oxygen. And above all, there is God Almighty who takes care of us and give us wisdom as we see these patients. But I would attribute this to the teamwork that is there in the unit. I don't work alone. There is another pediatrician who is here, Dr. Nyashadzashe Chasauka, who was manning this nursery during this time period as well. So it's a team effort together with sisters. It's a team effort, making sure that these patients, they actually get the care that they want. Of course, we may have our small issues here and there in terms of the number of incubators that we need to take care of these patients. Despite all those, the patient made it due to collective teamwork, due to the resources that we needed. Some of them, they were there, a few that we would ask the parents to go by, but they were cooperative. They were just there. We really want to thank them for being there for Christ's wish, because today we celebrate, and also for being patient, because it's a long journey. Imagine almost 4 months in hospital, and hoping that one day the baby will be discharged.